you for showing up. As usual, the lecture will be live streamed to YouTube. So for anybody who still has their camera on, if you're uncomfortable with that, you can turn it off now. But we do always like seeing your faces, so we highly encourage you all to turn them on. But yeah, then I'll just start with introducing the topic for tonight. So in the light of Mental Health Awareness Month, this week we have organized our Mental Health Week at the SIB, in which we hope to use our platform to spread awareness, to educate, and to support each other through whatever it might be that we are facing. During the past year, we have all been living through a time that has been very scary, uncertain, and lonely. We haven't been able to see our friends, our family, even go to the library to study or go to work. And it's not surprising that after a year of loss, loneliness, and financial struggles, we've all felt the severe impact on our mental health. People have been experiencing high rates of burnout, stress, anxiety, and depression. And I think that I can speak for all of you that this is not how we hoped our uni years would be going. Tonight, to give us an idea of how the pandemic has affected our mental health, as well as how psychology might have affected the course of the pandemic, we are joined by Dr. Stephen Taylor. Dr. Taylor is a professor and clinical psychologist at the University of British Columbia. He has authored over 300 scientific publications and more than 20 books, including a book named The Psychology of Pandemics, Preparing for the Next Global Outbreak of Infectious Disease, which was published right on time in December 2019. And yeah, now with that, I would like to give the word to Dr. Taylor.
Thanks very much. I have some slides which I will attempt to share. Can everyone see those slides?
Yes.
Yes? Excellent, thank you. So I gather the format is I talk for about, I don't know, 55, 60 minutes, and we open it up for questions and comments and discussion for another 30 minutes. Just to give you a bit of a background, where am I? Oh yeah. People often ask me why I wrote this book and why it has coronaviruses on the cover. That's accidental. I started working on this book in 2018. The reason why is my background is anxiety disorders and related clinical conditions, including excessive health anxiety. And about early 2018, it was the centenary of the so-called Spanish flu. And there were a lot of media interviews with virologists and experts in the history of medicine. And they're all talking about past pandemics, and they were all talking about the next pandemic. This was, a few years ago. And they were saying it's imminent and so forth. And I got interested in that. And the more I looked into it, the more I realized that psychology plays a huge role in pandemics. So a pandemic is not about some microbe going viral. It's about the behaviors of people that influence the spreading and containment of infection, and also the emotional reactions that people have. Anyway, so that's the basis of that. And throughout 2020 and 2021, my research group has been continuing to conduct research on the psychology of pandemic. We have a pool of several thousand adults from Canada and the United States that we've been following for over a year. So this evening, what I'd like to talk about is the importance of psychology in pandemics. Now, when I first started working on that book in 2018, I go to friends and family and say, I'm talking about how important psychology is in pandemics. And they'd look at me like I was mad. They'd say, well, pandemics are just some microbe going viral. But I hope that all of us now, having lived through COVID-19, understand how important psychology is in pandemics. I want to compare COVID-19 to past pandemics and relevant outbreaks. What we'll see is a lot of similarities, some noteworthy differences, some recent advances in understanding the psychology of pandemics, mental health resources, because now many of us are in a state of pandemic fatigue, which is a burnout-like state where we're just sick of the whole thing. People might be feeling a low-grade depression or irritability, and so mental health resources can be useful out there. And I'd like to finish up by talking a bit about life in a, quote, post-pandemic world. So, as you all know, the methods for managing pandemics require people to do things or require governments to issue messages that are credible. So communication from health authorities is essential. If you don't trust your health authorities, you're not going to follow their advice. For example, during the Ebola outbreak in West Africa in the mid-2000s, towns and cities were put under lockdown because of Ebola. The people who were refusing to cooperate, who were socializing and were not listening to the government, were the people who distrusted what the health authorities or the government was saying. So here we're talking about Ebola. So you can see that credibility is hugely important. People have to agree to do things like wash their hands, wear masks, get vaccinated, and so forth. And of course, psychological disorders can be triggered by the pandemic, and this happened, and I'll be talking about that in a minute, or pre-existing psychological problems can be worsened by the pandemic as well. There are all kinds of stresses associated with pandemics, and you would appreciate that having lived through COVID-19. One pervasive abstract stressor is uncertainty. Uncertainty is a stressor, an abstract stressor that pervades all aspects of pandemics. So uncertainty was present from even before COVID-19 was declared a pandemic. Uncertainty as to whether or not it would become a pandemic, uncertainty as to how bad things could be, as to how long it would last, as to what we should do, and so forth. And even today, we're seeing more uncertainties, uncertainty as to whether vaccination immunity is long lasting, as to which vaccines are safe, as to uncertainty as to whether we'll need booster shots, and so forth. So, and of course, there are the other obvious pandemic stresses. Disruption of social rituals is a important but subtle stressor. Many people are objecting that the rituals in their lives, the milestones, have been disrupted. For example, having to attend funerals via Zoom or having graduation ceremonies disrupted. Many people are saying that that's stressful and are experiencing a state of grief and loss of not being able to celebrate those milestones. And this is important not only because it's stressful, but also because it leads to non-adherence. People going out and violating government restrictions because they want to socialize or want to attend grad parties. And of course, for any of you who have young children, the disruptions of trying to work from home while caring for young children can be stressful. More generally, lockdown can be stressful for all kinds of reasons, including extremes of crowding or extremes of self-isolation. So in an important way, the psychological footprint is bigger than the medical footprint of pandemics. Now, by what that I mean is more people are affected psychologically than they are affected by actual infection. Now, this isn't to downplay the significance of the pandemic. Pandemic is very serious and many people become sick and died. However, many more people have become impacted psychologically, for example, developing symptoms of anxiety or depression. Just to give you an example, back in May, we surveyed 7,000 adults from Canada and the United States. And back then, about 20% of people reported clinically significant levels of anxiety or depression. And yet of our sample, only 2% actually knew anyone who'd been infected. So you can see there how the psychology is very important. Just to give you one more example, there's a kind of grief disorder called prolonged grief disorder. And that happens when you lose a loved one and you just never get over the loss. So ordinary grief, it's a long process. It can last maybe a year or so where you're feeling sad and you miss the departed. Prolonged grief disorder is like grief on steroids. It's a very severe condition, chronic, and the person never gets over it. So the person is unable to feel positive moods. They feel often depressed. They constantly yearn or long for the person who has passed away. Now, this is important because prolonged grief disorder affects about 10% of bereaved people. And during COVID, for every COVID death, there's been an average of 5 people, immediate family members who've been bereaved, spouses, parents, children, and so forth. So when you think of that, the amount of bereavement as a result of COVID is huge. It's 5 times bigger than the number of people who actually passed away from COVID. So there's another example of how important psychology is in pandemics. Pandemics tend to bring out extremes. So extremes of what we call over-responders. That is people who get excessively anxious about the pandemic. And the other extreme are the under-responders, people who think it's no big deal, who think it's exaggerated. But this is what pandemics do. The severe pandemics tend to bring out these extremes. Excessive anxiety about one's health, or germ phobia, or obsessive compulsive disorder. These are all conditions that can arise during pandemics or can be worsened. They can be pre-existing. Post-traumatic stress disorder and other stress syndromes. I'm going to be talking about PTSD a bit later on because it is important. Some people particularly people who've been hospitalized for COVID, are developing post-traumatic stress disorder. And this disorder can be chronic if not treated. And I mentioned bereavement already, and pandemic fatigue. So to compare COVID with past pandemics, there are lots of similarities. It's really quite striking. The rise of racism and other xenophobia has been, unfortunately, a feature of past outbreaks and pandemics. Quack cures and profiteering, people trying to profit from bogus products. Panic buying, the worried well rushing into hospital versus hospital avoidance. Both of these things happen during pandemics. Fear and avoidance of healthcare workers. Now, this is an important thing because healthcare workers are already overly stressed out, and burnout was previously an identified problem with healthcare workers. What we're finding during COVID is that some people, particularly the very anxious people, are frightened of healthcare workers because they have the misconception that healthcare workers are infected with the coronavirus. But again, this has happened before in past outbreaks. Sporadic looting and rioting, but more often a rise of altruism. So that's a more common approach to pandemics, fortunately, where people come together. Rumors and conspiracy theories, again, common in past pandemics. Curiously, the conspiracy theories we're seeing today are just recycled conspiracy theories from past pandemics. And refusal to wear face masks. This is not new either. This has happened before. It's important to realize that pandemics are dynamic events where things change over time. This is just a graph showing the percentage of people who are worried about getting COVID in Canada from last year. And you can see anxiety levels went up. Actually, as infection rates went up and as infection rates dropped, anxiety levels dropped as well. So what it has been found over the course of 2020, anxiety levels went up and down across communities, depending on what was happening in those communities. If there was a big outbreak of infection, anxiety went up. If things seemed to be settling down, anxiety went down. Now that's anxiety levels. Depression has been a little different. If you chart depression across 2020 in communities in longitudinal studies, you can see that people's moods gradually deteriorated over time. So people have become more and more, not necessarily clinically depressed, but dysphoric or feeling a low-grade, mild depressed mood. So that's increased as well. Anyway, pandemics are ever-changeable events. Even vaccination intention has shifted and changed over time. Across 2020, more and more people were saying that they weren't going to get vaccinated. And then when the vaccine started to roll out and people saw evidence that vaccines were generally safe, the intention to get vaccinated increasingly went up. Some important differences. One important difference between past pandemics is beliefs about the cause of disease. Now, this little picture here, you can see that's Dr. Schnabel. That's a plague doctor. That's personal protective equipment circa 1650. So plague doctors during the Black Death or bubonic plague would go from house to house, inspecting plague victims. Now, there wasn't much they could do except to count up the number of dead. But if you notice that the plague doctor has protective gloves and protective headgear with eyewear, there's a glass thing in there, but there's protective beak. Now, that beak is full of aromatic herbs. And this gets to the issue of beliefs about the cause of disease. If you go back a little over 100 years to the Spanish flu pandemic in the late 1890s, or go back to the bubonic plague, people believed that diseases were caused by miasma, that is noxious gases. So swamp gas or mists at night or gas or mists evaporating over rivers. So they didn't worry too much about getting into stuffy rooms, poorly ventilated rooms with people coughing. They were more worried about bad air at night. So they were more likely to shut their windows at night in their stuffy rooms. So that shows you how your beliefs about what causes disease influence behavior. Social media is a big difference between COVID and past pandemics. Of course, the 24/7 news cycle and the infodemic. We're being bombarded with information about COVID-19, including a mix of useful information and misleading or even fake news. So we've benefited from some lessons of the past. For example, you don't name pandemics after people or places or animals because that provokes either racism or the culling of animals. You don't call pandemics the Chinese flu or Wuhan flu because that promotes racism. You give them a neutral name. So that's some lessons we have learned from the past. One of the things that makes COVID quite different from past pandemics is the rapidly evolving views, which has to do with the evolving science behind what we know to keep ourselves safe. So if you go back to early 2020, the WHO were telling us not to wear face masks in the community for 3 reasons. They said they didn't believe face masks were useful in the community. They worried that if people in the community wore face masks, then there wouldn't be enough face masks for healthcare workers. And they thought that wearing face masks would lead to something called risk compensation, where if you wear a face mask, you're more likely to not wash your hands, or you're more likely to touch your face. Turns out all those reasons were wrong. And so later in 2020, the WHO were telling us we had to wear masks. So a complete 180-degree shift in information. So these evolving views, I understand where they come from, but they can be confusing to people. Just like the new CDC guidelines in the United States saying that vaccinated people don't need to wear masks. The more you change guidelines for people, the more people can get confused, and it leads to non-adherence. This is another example of shifting views on pandemics. Early 2020, the WHO were pushing the idea that contaminated surfaces is the main way you got infected with COVID-19. That turns out to be not the case. The surfaces aren't what are going to make you sick. It's aerosols and droplets. However, people have persisted in scrubbing and cleaning because it gives them a sense of security. And that gets back to the goals of pandemics, managing pandemics. There are 2 goals. One is to reduce the spread of infection, but the other goal is to keep the population or keep the community calm. In past pandemics, there's been concerns about mass panic, which usually doesn't happen, but we're trying to keep people calm but also getting them to take it seriously. And this so-called hygiene theater, this cleaning of surfaces, gives people this sense of security. It keeps them calm. It is a false sense of security, but it's not necessarily a bad thing unless you're spending large sums of money cleaning. But just because people clean, it doesn't mean they stop doing other things like wearing masks. I'm going to compare COVID to other outbreaks, and what you'll see is the psychological phenomena we're seeing now during COVID are much the same. So everything old is new again, but there's just more of it and faster. So in 1918, during the Spanish flu, there are all kinds of folk remedies, like eating onions was supposed to keep you safe. 2020, it was the same deal. People were advocating drinking water or tea infused with garlic. It was a folk cure, it didn't keep you safe. Quack cures, very popular during the Spanish flu. The same has happened in 2020. I mean, there are so many quack cures out there that the US Food and Drug Administration has a website up, and they have a program. It's called Operation Quack Hack, and it's designed to regulate all these bogus products that are out there. Desperate measures in 1918, people were drinking hydrogen peroxide, reasoning that, well, if it kills germs on surfaces, then if I drink it, it will keep me safe. Don't do it. Something similar happened in 2020, people drinking hand sanitizer. Profiteering, people trying to make a profit from pandemics. This is nothing new either. Here we see here from 1918 is Ad McGregor's Fine Old Scotch, a real tonic for the flu. Well, in early 2020, Coca-Cola were doing the same thing. This is an ad in Times Square where Coke were trying to pair social distancing from staying safe. Super spreading. In the past, it's been mainly focused on super spreading individuals. This is Typhoid Mary, who She was dubbed Typhoid Mary in the media in the early 1900s. She was an asymptomatic carrier of typhoid. And so she was shedding virus and infecting people. So she was a super spreader and probably the most famous super spreader. Now, we're seeing some cases of super spreading individuals during COVID-19, but what is more common are super spreading events, people crowding into crowded, poorly ventilated venues such as clubs or bars, or attending big funerals or weddings. Those are the things that tend to be spreading COVID. I mentioned the infodemic, and I want to explain in more detail why this is a problem. It's a rapid spread of information, both reliable and unreliable. So people are being bombarded with information of uncertain accuracy. The problem it makes, it not only creates problems for the general public trying to understand what to do and what information to believe, it makes problems for researchers as well. The amount of COVID-related psychological research in 2020 exceeded all of the research on the psychology of pandemics for all previous years, for all outbreaks combined. There was so much research, but a lot of it was junk research. For example, PTSD research that hadn't properly assessed traumatic stresses. So for those of us trying to sort out what is the current state of knowledge of COVID and to try and make policy recommendations, and that's part of what I do. I'm part of the Canadian federal government's expert panel on COVID-19, which we recommend policy. But the problem is there's so much junk research out there, it makes it difficult to sort through it, to look for the good research. It'd be challenging. Talk a bit about our COVID stress study. So I mentioned these two syndromes, over-responders and under-responders. The over-responders have this so-called COVID stress syndrome, and the under-responders have what we've been calling a COVID disregard syndrome. Now, this isn't a syndrome in the medical sense of the term. It's a syndrome in the sense that it's a constellation of correlated attitudes and behaviors in this COVID disregard syndrome. So it's based on the idea, and if there's one takeaway from this talk I'd like people to bear in mind is most people are resilient to stress. The majority of people will bounce back from COVID-19. Not everyone will, and it's difficult to peg a percentage. Maybe 20% of people will have enduring psychological problems after this pandemic, then they'll be in need of psychological help. Most people will bounce back. But the extremes are the highly anxious extreme and the extreme that don't take it seriously. Now, let me explain what I mean by these syndromes. This COVID stress syndrome, at the heart of it, is fear of getting contaminated. But people with this syndrome they tend to be xenophobic, that is frightened of strangers for fear that they'll get infected. They have traumatic stress symptoms, that is, they have nightmares and intrusive thoughts about the pandemic. They're compulsively checking the news, seeking reassurance that they're healthy, and they're worried about the socioeconomic impact of COVID-19. So this syndrome is what we would call an adjustment disorder. That is an excessive amount of anxiety in response to a stressor. We're expecting that for many people with this syndrome, it will naturally abate over time. And when the pandemic is over, many of these people will find that their anxiety has settled down and they're fine. But this won't happen for everyone. Some people will develop chronic problems for which they require mental health services. So that's the COVID stress syndrome. This is a COVID disregard syndrome. Now, the media would have you believe that it's young people who have the syndrome, but that's not quite true. It happens in people in all walks of life. These are people who think that COVID is no big deal. They're not concerned about getting infected. They don't see the need for them to socially distance. They tend to have poorer hygiene, and they tend to be anti-lockdown, anti-mask, and anti-vax. So these are the people who attend parties, and some of these people attend protest rallies claiming that COVID is a hoax. The question arises as to why some people would develop this syndrome where they thought the whole thing was no big deal. And that might have to do with the experience of COVID-19 for many people these days. For most of us, this is not something that we would see on a daily basis. This is during the Spanish flu in 1919 in San Francisco. This is a coffin truck. designed to deliver coffins to people in the communities. The Spanish flu, people had a personal, up and close experience with death. They could see hearses every day. There were funerals every day. The sights of coffins were commonplace. Death was pervasive and ever present for people. This is not what we're seeing during COVID-19, at least for many people. For many people, it's an abstract stressor where they learn about it, not so much as in knowing someone who was infected or getting infected themselves, but watching news of COVID via the internet, by social media, by the news. And for some people, that has given them this abstract, unreal sense of this pandemic, which can lead some people to downplay its significance. Panic buying, there's nothing much new there. In fact, there was some panic buying in the United States just earlier this week. It's like people in the community now have become conditioned, a little bit like Pavlov's dogs. Whenever we hear about a threatened lockdown or a threatened shortage, people start to panic buy. And this happened this week in the United States because of a cyber attack on the Colonial Pipeline, in which there was a threat in the southeast United States of a gasoline shutdown that caused widespread panic buying of gasoline. So over the course of 2020, as a result of all these panic buying episodes, people have become primed or conditioned to expect to have to panic buy. This is not new, of course. In 1918, there was panic buying of Vicks Vapor Rub, which was a gel people rubbed on their chest to make breathing easier, and all kinds of things from pharmacy stores. Of course, in 2020, there's the panic buying of toilet paper. In Canada, where I live, there's been panic buying of cannabis. And in the United States, well, as you might guess, there's been panic buying of guns and ammo. So there are all kinds of elements to panic buying. But by the way, if the Dutch government announced tomorrow that there was going to be a curfew and that you had to be off the street by 8 p.m., that would trigger panic buying. There would be more panic buying. Anytime there's this threat of lockdown in communities, it precipitates panic buying. So people are out panic buying, not because they're worried that there'll be a threat to the supply chain. So they're not worried that, oh, the food or so forth is going to dry up. They're panic buying because of the behavior of their fellow shoppers. It's game theory. So if I hear about panic buying down at the store where people are buying up all the beans or buying up all the toilet paper, according to game theory, it's a zero-sum game. If I don't go down there and panic buy as well, I will miss out. So this fear of missing out is driving panic buying for many people. And often the people who initiate panic buying are people who are highly anxious. They have this COVID stress syndrome. They're worried that they might run out of supplies. And behavior is contagious. If I walk into a supermarket and people around me are acting in a panicky way, buying up supplies, I'm going to look to that and say, oh, there must be something going on here. I'd better start stocking up as well. So fear can be contagious in a way. But it's not just anxiety that's involved in panic buying. There are people with so-called dark personality traits who are buying up stuff as well. These people tend to be narcissistic, Machiavellian, and psychopathic. So these people with these dark personality traits, they're trying to profit on the situation. These are the people who go up and buy up mass quantities of hand sanitizer to try and sell it on Amazon at a profit. So not everyone who's panic buying is actually panicking. Some people are panic buying because they're really anxious. Other people are panic or buying up stuff because they're wanting to make a profit from the situation. Community leaders, politicians, when they hear about panic buying, it's been so predictable. The community leaders react with bewilderment and frustration when they hear about panic buying. They get up and they keep telling the community, don't panic. That message backfires. It's something called the innuendo effect in social psychology. If I say to you, and I do it in an animated, urgent fashion, don't panic about buying food, that's going to pair in the minds of many people food and panic, that there's something to be panicking about. So this don't panic message usually backfires and the whole thing snowballs. Just to illustrate this, we're told to stock up with a 2-week supply. That causes people to flock to stores with the common goal of stocking up. A small group of highly anxious people over-purchase out of a sense of fear and urgency. And there's this fear contagion effect amplified by dramatic images going viral of panic buyers. So as I mentioned, the purchasing is driven by the behavior of other shoppers, not by a threat to the supply chain. And so this fear of scarcity creates actual short-term scarcity. And this amplifies the whole thing. And the panic buying dies down until the next cycle begins. Now, there are two ways of getting ahead of the crowd when it comes to panic buying. One is to be a survivalist, where you always have things stocked up. And that's a kind of extreme thing to do, to be always living in survival mentality. The other approach is to wait for 7 days. Episodes of panic buying tend to last about 7 to 10 days. There's been research done worldwide on this over the past year or so. 7 to 10 days. So if you hear that there's going to be a lockdown and you hear that people are panic buying, many people respond to that by saying, oh, I better rush to the stores to get ahead of the crowd. The problem with that line of thinking is everyone is thinking the same thing. So if you think, oh, I'm gonna deal with this panic buying by getting ahead of the crowd by rushing out right now to the store, you'll be in the middle of the crowd because everyone is doing the same thing. So the way to beat panic buying is to wait for a week. If you can wait for 7 days, then you'll find that the stores will be empty, the crowds will have gone, and the shelves will have been restocked. So that's my advice. If you hear about panic buying, don't rush out to the stores. You might put yourself in a super spreading situation. Wait for a week if you can. Rise of altruism has happened before, but it's a conditional sort of altruism. You probably have the 7 p.m. cheer or the nightly cheer for healthcare workers. And that's great, that's altruism, but we've been finding in our research that just because you're cheering, it doesn't mean you can't have stigma. And we found that many people in the community were frightened of being around healthcare workers, including the people who cheered. They were happy to cheer from the safety of their balconies, but they weren't willing to get into an elevator with doctors or nurses. So we found in this sample of a couple of thousand people from Canada and the United States, none of whom were healthcare workers in this sample, about a third of these people thought that they had these misconceptions about healthcare workers. They thought workers were more likely to be infected. They thought they should be segregated from the society and from their friends and family. So these misconceptions were driven by lack of information and anxiety. And this just adds another layer of burden upon healthcare workers. Mask rebellion is not new. In 1919, they tried to mandate masks, which caused the formation of the Anti-Mask League, which was a short-lived anti-mask movement. It never really got off the ground, this league, because they lacked the advertising infrastructure that we have today. They lacked social media, for example. But interestingly, the reasons for the Anti-Mask League then are the same as the reasons today. These people said they didn't like wearing masks because they thought they were ineffective, they were uncomfortable, and they didn't like being forced. And this thing, not like being forced, is important. It's called psychological reactance. This is my son back when he was 3 or 4 years old. He was the king of psychological reactance. I remember once telling him, he's now 16 and super mellow, but I remember once telling him, Alex, it's time to go clean up your Legos. He looks up at me and he says, you're not the boss of me. And that's psychological reactance. It's an allergic reaction to being told what to do. You're not the boss of me, he says. I looked down at him and I said, you know what? I am the boss of you. Go clean up your Legos and put your monkey mask on. So this is reactance that you see in adults. It's what happens when you walk up to someone on a bus who's not wearing a mask and you say, hey, you should be wearing a mask. It can elicit psychological reactance, which involves two things. If you walk up to someone on a bus not wearing a mask, they could become very angry that you're telling them what to do, and they could generate counter arguments for why they shouldn't have to wear a mask. So when you directly try and argue with someone who has this high level of psychological reactance, it backfires. So you need to look at alternative ways of messaging to encourage people to do things that doesn't get around their reactance. For example, appealing to people's sense of community. So there are all kinds of messaging strategies to get around psychological reactance. Now, the question is, do we need to use them for mask wearing? We might not. If you've got 85 to 90% of people wearing masks already, that could be good enough. And with the vaccine rollout, reactance around masks mightn't be such of a problem. But psychological reactance plays a role in anti-vax attitudes and in anti-lockdown as well. Conspiracy theories. Disease outbreaks are commonly this topic of conspiracy theories. For example, the Zika pandemic, the theory that it was part of a plot by the New World Order to depopulate the planet. And this is an old favorite conspiracy theory. It gets recycled every time there's an outbreak. The New World Order doesn't exist, by the way. It's a shadowy, fictitious organization. During COVID-19, the theory has evolved now that Bill Gates is in charge of the New World Order. The idea is that they depopulate the planet so they can take over. It's SARS is a bioweapon. COVID, the conspiracy theory that if you live in the United States, there's been a conspiracy theory that COVID was a bioweapon produced by the Chinese. If you live in China, there's a conspiracy theory that COVID is a bioweapon created by the Americans. So there's a bunch of these all similar. In 1918, there was a conspiracy theory that the Spanish flu was being produced by the Germans who were coming ashore to Manhattan in the dead of night in submarines spreading infection. So people who believe in conspiracy theories, if you believe in one, you tend to believe in multiple ones. So if you believe that COVID is a hoax, you'll also tend to believe that NASA faked the moon landing, that 9/11 was an inside job, and the government's hiding evidence of extraterrestrial contact. So these people, they tend to believe in multiple conspiracy theories. They tend to be suspicious and believe in the paranormal. They tend to be narcissistic and have this need to feel unique. And what better way of feeling unique than to tell yourself that you have special knowledge that the rest of us don't possess? They have difficulty distinguishing fake news from real news and poor skills at analytical thinking. Really difficult to change conspiratorial thinking. For hardcore conspiratorial thinkers, if you try and persuade them, let's say you try and persuade them that COVID is not a hoax, they will conclude that you are part of the conspiracy. You can, inoculate people who haven't heard about the conspiracy theories. You could say to someone who hasn't heard of the 5G conspiracy theory, you could explain to them why it's bogus. The problem is, if you do that, you're introducing the conspiracy theory to a broader number of people, which is not what you want to do. So it's really challenging. Vaccination attitudes have risen and fallen, and part of it was the concern the whole thing is being rushed, and of course concerns about side effects. I think vaccination uptake during COVID will gradually increase as people get to see that vaccines, particularly, I guess, the Moderna and Pfizer vaccines, are safe. Part of the problem is this whole vaccine thing had been called Operation Warp Speed, which is really the wrong thing to call a vaccine production program because it implies that things have been rushed. So that was something that should have been anticipated. Pandemic fatigue is not new. It's this progressive demotivation associated with a progressive disregard for the social distancing. So as lockdowns persist, people get fatigued, they get burned out, they get irritable, and they don't comply as much. And if you're interested, there's a really nice monograph available online from the WHO about pandemic fatigue. Public health messaging is hugely important in getting people to do things during pandemics. And I want to give you some examples about how public health messaging can go badly wrong. I'll give you 3 examples. One is good, the other is bad, and the third one is simply ugly. This is a good form of messaging, targeting people who are not taking the pandemic seriously. So this is the narrative story message. And these are true stories. This is one on CNN about a guy who went out to a party, thinking it was no big deal. He got infected and then went home and got 14 of his relatives sick. So he goes on CNN and he says, well, I thought it was a hoax or exaggerated until this happened to me. That kind of messaging reaches people, particularly the people who aren't taking it seriously. The message, stock up with a 2-week supply of groceries, it might seem like a good message on the surface, but it precipitated panic buying because everyone went to the stores with the same goal. So you need to be really careful. Even a seemingly innocuous message can backfire. The third example, it was just a plain offensive message. This was circulated a few weeks ago by the BC government. They thought they'd help people cope with stay-at-home orders and restrictions by creating this, what they thought was a fun self-care bingo card where you could choose little options to cope with lockdown. You could make a blanket fort, you could read a book, you could phone someone, you could cry, you could let it out. When people saw this self-care bingo card, the community was outraged. They thought it was condescending, ableist, and insensitive. This sort of message should have been pilot tested before presenting it to the public. So this is why we need more psychology in pandemics. We need things like Behavioral Insights Group. This is just a logo from a British group, but there are groups in many major or many countries in which the goal of these groups is to analyze and understand messages that are given out to the public to try and create messages that are likely to be beneficial. Messages that encourage people to adhere to social distancing, messages that don't trigger panic buying, messages that don't outrage the community. Mental health consequences of SARS infection. WHO, well, I'm not sure how true this is, but there's certainly a lot of trauma out there. And there is evidence accruing showing that about a third of people hospitalized for COVID are at risk for developing post-traumatic stress disorder. And this disorder can become chronic if untreated. During COVID, there's been a rise of mental health resources. You've probably seen some of the online resources or the phone apps. And there's been some other things like military applications for enhancing resilience in healthcare workers, which I want to talk about. These are some of the apps, phone apps, for example, MindShift. They teach people cognitive behavior therapy, or CBT, and that's a method for learning ways of managing moods like anxiety or depression. There are online cognitive behavioral programs. These have been all kind of reactive rather than proactive, but I think the best example of a mental health program during COVID was set up in China, in Chengdu, which is the capital of Sichuan province, in March of last year. So these people jumped on this really quickly. They realized that mental health would be a huge issue. So they, about 24 mental health workers, they developed a 4-point mental health program. It started out with a live media group where every evening they were broadcasting TV programs and radio programs, educating people about the psychology of pandemics and the mental health issues that could arise during lockdown and how you might cope with them. So that informational thing, and all this was tied into social media as well. And then people could phone in a hotline consultation group if they had concerns or problems. And this was widely utilized. So people learned about the hotline through the live media group and social media. They could phone in with problems, for example, difficulty managing anxiety during lockdown. They could try and get some advice. If that wasn't enough, they were referred to an online video intervention group. So a Zoom meeting. So notice there's 3 tiers or 3 levels of intervention: education, phone hotline, video. And the 4th component was an in-hospital on-site crisis consultation intervention group. So treating COVID survivors and mental health workers. Brilliant program. We need something like this because we will have some important mental health issues to deal with in the aftermath of COVID-19. There's been some military applications for enhancing the resilience of frontline workers. And as you know, frontline worker burnout has been a huge problem even before COVID-19. Managing burnout requires, broadly speaking, 2 things. One is people need the infrastructure to do their jobs well. So they need to have sufficient amounts of equipment, personal protective equipment. They need to have resources so they can get enough sleep. They need to have strong leadership to help guide them through stresses. They need to have leadership that limits the amount of minor stresses in their lives, like paperwork and so forth. And of course, there are the psychology side of things, the individual things like cognitive cognitive behavioral strategies and resilience training. Peer support is very important. One that looks very promising is a buddy system called Battle Buddies. It's adapted from the military. In the military in the United States, new recruits will be paired up with a buddy, and the buddy would be similar in demographics and seniority, and the buddy would be the person that you debriefed with at the end of the day, that you discussed any problems you had and talked about brainstorming ways of dealing with them. That's been applied to healthcare workers. So you might pair up a doctor with a doctor of similar seniority or a nurse, and they debrief one another and provide mutual support. So those support systems are very important and look very promising for boosting resilience. I want to wrap up by talking a bit about life in a post-pandemic world. You notice I've got post-pandemic in quotes. What's going to happen is that you're not going to wake up one day and the WHO will say, oh, COVID-19's gone. Oh, I don't know what happened. It's just all gone. That's not going to happen. One day you'll wake up and the WHO will say, we have now entered a post-pandemic period. And what that will mean is COVID-19 will still be around. There'll still be infection circulating in the community. People will still be getting sick and dying, but the rate of infection will be sufficiently low that governments can open up the community. So that's what they mean by post-pandemic world. So there still will be some risk out there. It's a kind of good news, bad news situation. The bad news is we know that there will be long-term problems. SARS, MERS, COVID-19, we know some people develop post-traumatic stress disorder. We know that people are experiencing, particularly people with pre-existing problems, an increase in OCD and germ phobia, and some of those can be chronic and requiring treatment. Long COVID, some people are developing things that look like chronic fatigue syndrome as a result of COVID. There are all kinds of long COVID syndromes, but that's one of them, and that's going to require long-term care. And then there's prolonged grief disorder, which I mentioned a bit earlier, and that's just some of the calculations. And then there's the post-pandemic economic recession. Now, the reason why economic recessions are of concern is that when economic recessions occur, they are typically associated with an increase in suicide, particularly historically at least, in working age men. This happened during the Great Depression in the 1930s, spike in suicides, mainly among men. So the concern is if there's an economic recession after COVID-19, there could be an increase in suicide. It happened after the Spanish flu in the year afterwards there. Time will tell. Hopefully that's not going to happen. Or if it looks like it could happen, then it's important that governments step in with aid programs to offset the impact of unemployment. So that's the gloomy stuff. Some good news. So in the midst of a pandemic, people often ask, are we going to move from this to this? Are we going to move from this? Now, I want to read this out to you. This shows you the degree of fear some people were experiencing back in 1918, that some people are experiencing now. I'm just going to read this quote from the Spanish flu. Quote, people were afraid to kiss one another. People were afraid to eat with one another. They were afraid to have anything that made contact because that's how you got the flu. It destroyed the intimacy that existed amongst people. You were constantly afraid. You were afraid because you saw so much death around you. You were surrounded by death. So are we going to move from this to this? Of course, they did. 1918, 1919, everything was shut down. Everyone was wearing masks. A year or so later, no one's wearing masks. It's the roaring 20s. The same thing will happen with COVID-19, and we're seeing evidence of this already. This is Wuhan in August after they were released from lockdown, a massive pool party. This is Bournemouth in the UK in the summer of last year, where people actually actively violated stay-at-home orders and partied on the beach, people of all ages. Spring break in the United States. Do you know the police in Miami were managing COVID-19 with pepper spray? They had to pepper spray the crowds to get them to disperse. This shows you, among other things, how people bounce back. We're inherently social creatures. Being social is built into our genome. And when you tell people to go into lockdown, they have to thwart that urge to socialize. And when you release that lockdown, people do bounce back. Most people do. And here's a concert in Barcelona just recently. They said, okay, we're going to have a trial run, a test concert, enclosed venue. To attend this concert, it can be 5,000 people. You've got to wear a mask. You've got to be tested for COVID beforehand, and you've got to agree to follow-up testing. They said, yeah, fine. And look at that. You've got a rock concert with 5,000 mask-wearing people there. It just shows you how much people bounce back. So most people are resilient. It's been really tough to find evidence of psychological scars of post-pandemics. Although pandemics do shape culture and art and society in some ways, they tend to be subtle. There may be a short-term rebound of hyper-sociability after this pandemic, a sort of roaring 20s scenario. But what's going to dampen that is we'll be in a post-pandemic period where there still will be COVID-19 circulated in communities. And then there's a phenomenon called post-traumatic growth, which I want to finish up on. Post-traumatic growth is where you don't just bounce back after going through a trauma, you actually grow as a human being. And we just published a study on this. So we asked people, has anything positive come out of COVID-19 for you? And 2/3, these are people who had not been infected, they said yes. They said they developed a stronger appreciation for friends and family, greater compassion for others, feeling more resilient, and a deepening spirituality. So for some people, and perhaps many people, they will grow as human beings as a result of going through this pandemic. So that's a positive, encouraging sign. And it would be important to see whether these gains persist in the longer term. So just to wrap it up, in terms of the future of pandemic mitigation, pandemics aren't simply about some microbe going viral. They're about what we do or choose not to do. That we need more psychology in the management of pandemics, and we need more of this Chengdu style psychology where it's multifaceted and it's proactive, and it's designed to reach large numbers of people in the community. And we need to, well, as I just said, proactive rather than reactive. So with that, I'll wrap things up and open it up for questions and comments and so forth.
All right, thank you very much. Then we'll now move into the Q&A part of the lecture. Everyone, please just feel free to raise your hand and ask a question yourself if you want, or send it in the chat, then I'll read it out loud. And I can see that Alan has already raised his hand. Go ahead.
Yes, I want to ask because I saw the picture of the coffins who were passed around in the Spanish flu pandemic, and it reminded me of a picture that, at least in Italy, like made the news quite a bit, and it was the row of military vehicles transporting the dead in Bergamo. And I thought, why, like, do you think that picture would have the same impact today? Because Italy still is filled with deniers and like people who refuse wearing masks, even if it was the epicenter, and lived in a sense the same thing as the distribution of coffins as we saw in the Spanish flu. Do you think it will be like it had a different impact this time around?
I think for the hardcore conspiracy theorist, the person who lives in a silo, who only interacts with other conspiracy theorists, they're going to persist in their belief that COVID is a hoax. And that's because they get all their feedback from other members of their group. It's like belonging to a cult. So they're going to persist in seeing it as a hoax. But for many people, if not most, just the simple sight of, say, in Italy, the military vehicles moving bodies, or in New York, the sight of refrigerated vans on street corners, and you know what was in those refrigerated vans, who were bodies. That makes the immediacy a whole lot stronger. So a coffin truck would do it, but if all the news you got about COVID was sitting in lockdown in your apartment, the news on social media, you could see that as a hoax or not take it seriously.
Okay, thank you. Then I'll move on to one question that was sent in through YouTube. And Ramses is asking that you said that people are more likely to believe in pandemic conspiracies if they already believe in other conspiracies. Are people more likely to believe in those conspiracies if they are religious?
That's a really interesting question. It depends what kind of religion. There's a far right form of religious fundamentalism in the United States that's tied to white supremacy. And these people tend to buy into these COVID conspiracy theories. So they already tend to be conspiratorial thinkers, but they're religious conspiratorial thinkers. So it is an extreme Christian subgroup. So those sorts of people are more likely to buy into them.
All right. Ellen, your hand is still up. Do you have another question? Okay. Then I've got another one from the chat that was sent in by Conrad. And he's asking, what is the difference of the roles of psychology in explaining versus in shaping the behavior during the pandemic? And should psychology be used more to shape behavior? Or the bit nudge unit comes to mind? BIT?
Yeah. Psychology plays a role in both things. It's really not enough for us to explain socially important phenomena. We need to have a way of translating that understanding into ways in which we can have positive social impacts. But it depends on the way you do it. If you're seen as using psychology to persuade people, some people are going to object to that. You know, the people with psychological reactance. You're not the boss of me. You're not going to try and manipulate or persuade me. So that kind of approach can be difficult. But if you're using psychology to help provide people with informed choices, that can be more useful. Now, just to give a vaccine example. So I could try and persuade you to get vaccinated by bombarding you with all kinds of reasons, although I could say, okay, or I could try another approach. The other approach would be, it's important for you to be properly informed, and then I could educate them about the do it for the herd approach. The idea that you achieve herd immunity. You might not think that you're vulnerable to COVID-19, but by you getting vaccinated, you're doing something for your community. So it's using psychology, the idea that, oh, these people won't get vaccinated if they don't think it's important for themselves, but they will get vaccinated if they can appreciate the broader impact. So we're not trying to manipulate people or persuade people. We're just putting this out there. Okay, a fact is that if you get vaccinated, it's going to have a beneficial effect on your community. So we're using that psychology insight to shape or nudge people, but without being heavy-handed about it.
Right, thank you. I hope that answers your question, Conrad. Nina, you've got your hand raised.
Yes, I was wondering, do you think that also the way we or the media talks about, especially the COVID pandemic, plays a role? Because when you listed sort of the consequences of this pandemic, I noticed that most of the things were sort of negative things. So you start panic buying, there's xenophobia. Yeah, and then there was this one positive point, there's more altruism. So I was wondering whether it might change if people focus more on the positive consequences of this pandemic. And of course, that only works to a limited extent because it is a pandemic after all. But yeah, what do you think about that?
I think it's a great approach. And we've been encouraging people to do that as part of post-traumatic growth, encouraging people to reflect back on the past year, to ask whether there's been any positive changes in themselves, whether they've grown as human beings and so forth. So yeah, there's that component. And I guess the whole thing with social media, it can be used for positive purposes, or if people get their news from social media, they're likely to get distorted news. So it's a two-edged sword there.
Okay, thank you. Does anybody else have a question? Then I might just ask one of myself. So obviously every person that is now living through the pandemic is going through a very, very different personal situation. What would you say age demographics, or what would you say is the role of age demographics there? Who is affected worse or in different ways, like young children, or is it adults or seniors living alone? How would you say that age influences how you deal with the pandemic?
Different demographic groups are impacted in different ways, and they have different concerns. So for young children, for school-age children, some of the biggest stresses they're reporting are the stresses of managing school from home and the disruption in their socialization, and worrying about being able to get good grades as a result. So for the young ones, it's school pressures and boredom and disruptions in socialization that are some of the biggest sources of distress for them. And you contrast that to elderly groups, including groups in long-term care facilities. For them, it's social isolation, boredom and loneliness that's an issue, along with worries about becoming burdens on one's family. And then for other people, it very much depends on their own life situation and circumstances. So different people can be impacted in different ways across demographic groups. The people who are underprivileged, as people with food insecurity and so forth, they're also impacted in ways. For example, panic buying has impacted them, reduced their ability to feed themselves because other people are panic buying. So that's another example how different individuals are impacted in different ways. And then, of course, there's the impact of actually getting infected, that whole long COVID thing, having to deal with chronic, drawn out symptoms.
All right, thank you. Then Conrad, you've got your hand raised.
Yeah, also thank you for your answer to my other question. I looked you up before the lecture, and I would like to know how for you it is to combine underwater photography and making pictures for photographic journals. Then how does combine that with the academic work?
Well, it's my hobby, and I would try, and I can go scuba diving out of Vancouver. So what I'd been doing is every weekend, every say Saturday or Sunday, I'm out of here. I turn off my computer and I go scuba diving and just go floating away. It's in my little quiet zone, taking pictures or hanging out with friends. The problem is, though, with lockdown and so forth, I haven't been out last weekend I managed to get out diving. I hadn't been out for 9 months. So I'd been in lockdown too for 9 months, and it was so sweet last weekend getting out into the water. It was just heaven. And I'm going out again this weekend. So I try and juggle it, but the last 9 months has been so busy, and with all the restrictions as well, that I hadn't been able to get out. But it gets to a broader point. It's really important to have a balance, a work-play balance in your life. And if you don't have one of those, it's a recipe for burnout.
Yeah, and you said you're also an expert on anxiety.
Yes.
And I read before that scuba diving was a thing that was recommended for people with anxiety, because apparently it's like very much a nice thing to to help if you have anxiety, because if you go into the water then you're very much alone with yourself. And I don't know, do you think that's part of it, why you like it?
It can be. It depends on the sort of anxiety problem. For people who have panic attacks, going in the water can trigger panic and can make it worse. But for other people who are just stressed out from their daily job, they have too many things to do, getting out and floating in the water, it takes you into a completely different world. And there's no cell phones down there. It's really nice. Very relaxing.
Thank you.
I would have thought that scuba diving is a quite corona safe hobby, since you're alone in nature wearing a mask, but I guess everything is very limited. No matter what hobbies you have. But Linda or Yosha, you have a question?
Yes, that's me actually. First of all, thank you very much for this very interesting lecture that you've given. I genuinely really enjoyed it. I was wondering, since you've consulted for the Canadian government on policy areas in terms of COVID response, what, in your professional opinion, do you think have been some of the most damaging responses from different governments? or perhaps some of like the better responses in terms of, COVID, dealing with the COVID situation and how they've acted towards their towards their populations and stuff?
The most damaging ones are the ones that promote racism and provoke a distorted picture of the pandemic. So just to backtrack, managing pandemics is tricky because there are lots of uncertainties, and it's easier to criticize a government in hindsight because they have to take action on particular issues. For example, do I declare a lockdown right now? There's so many uncertainties and you're taking a gamble and hoping that you get it right. So that said, it is really difficult. However, back during the Spanish flu, there were political leaders who blundered by saying, oh, it's just a little bit of the flu, it's no big deal, nothing will happen, there's nothing bad here, and they get it spectacularly wrong. And during COVID-19, that happened too, with Boris Johnson going around to the pub, shaking people's hands, thinking it's just a little bit of flu. Next thing you know, Boris is in intensive care. Or Bolsonaro, the president of Brazil, saying it's just a little flu, and then suddenly he gets infected. Or Donald Trump telling people that they should inject bleach or that they should take hydroxychloroquine as a game changer, leading to overdoses and poisonings. Or he's repeatedly referring to it as the Chinese virus, which stoked racism. It made racism, made a bad situation even worse. So they're the sorts of approaches that aren't good. Contrast that to approaches which are more calmer and consistent. The Prime Minister of New Zealand, for example, a consistent, calm approach in which they're not implementing too many dramatic changes, but just by keeping things calm. Because the more you mix things up and change things up, the more people will get confused. So a transparent approach to communication where you're consistent, you're being seen as reliable. If there's an issue that you don't know the answer to, the good approaches are where the political leader, the prime minister or so forth might say, I don't know the answer to that question, but it's an important one. We're going to take these steps to try and answer that question and get back to you. So the public can get a sense that their leaders are consistent, trustworthy and reliable.
All right, thank you. I hope that answered your question, Joshua. We've got one more from the chat from Matthias. He says, your discussion of psychological reactions to pandemics seem to mostly address extremes, those who are fully skeptical of guidelines and those who fully believe in regulations. But what is the psychology between those who are found in between? Can you explain the behavior of the mildly skeptical who only somewhat follows guidelines?
Yeah, the mildly skeptical, these tend to be the people who follow the guidelines. But that said, the longer these lockdowns and restrictions drag out, the poorer the adherence. So the mildly skeptical and so forth, during 2020, their adherence to social distancing gradually decreased. Well, it did as a community, where suddenly we're socializing outside of our bubbles or outside of our groups more and more because we're frustrated and we're sick of COVID. But the one thing that didn't change during COVID-19, at least in the United States, was mask wearing. Most people were still wearing their masks. Maybe that was because it was mandated on buses or so forth. But here's the thing, for most people, all you need to say is wearing a mask is mandated, and they'll say, okay, and they'll go along with it. It's only those extreme groups with psychological reactance which will say, I'm not going to wear it because you're not the boss of me.
Okay, thank you. Then Conrad, you have another question? No, all right, your hand is still up. Joshua, Linda, you have a question now. Yes.
Yes. So obviously during the COVID-19 pandemic, we've received like emails from our university as well, offering some sort of support and advice. And I don't know, maybe it's just me personally, but I don't feel like these are very effective, and I'm less inclined to take up support from the university. And I was wondering, what is it about the help offered by an institution maybe that makes people like myself not likely or less likely to take up that help from them? and what can they change maybe about the messaging and the way they're offering their help? Because from what I remember, it's mainly emails, to maybe better offer support and to get people to actually take them up on the support.
It's a really important issue. It gets to the fact that no single form of messaging or no single form of assistance is beneficial for all segments of the community. So an email of, let's say, student health services, an email that goes out offering advice to people, that might reach some people. For other people, they might think this doesn't really speak to them. And so for those individuals, alternative forms of messaging might be useful, such as peer support, a peer support program, or at least grassroots involvement where fellow students are getting together and devising programs or strategies for improving the support that they can give to one another. So it's essentially providing people with the options to choose resources or services that fit their needs.
All right. Thank you very much. Is there anybody else who would like to ask something? Okay. Well, in that case, I would say if there are no more questions, then I would like to thank you very, very much for coming, Dr. Taylor. It was a pleasure. Great overview of, everything one could learn about the psychology behind the pandemic. Thank you very much for coming. Sadly, since this is an online lecture, we're not able to give you a token of appreciation as we would like to do. But we will be sending you an online book voucher, so look out for that.
It's very kind of you. Thanks so much. And thank you for inviting me, and thank you for all the really good questions and comments. They were really good.
Thank you for joining.
Right.
We will move on with a few announcements.